Alright, now we're moving on to the musculoskeletal check. If you didn't get checked off on nervous system, obviously you have to do that first. So we're looking at both muscles and bones. Behind me here I have a list of some structures. Some are muscles, some are bones. Rectus femoris, muscle or bone?
Muscle.
Show me where it is on yourself. Point to it. If you're pointing to your upper thigh, you are right. Some of you are not pointing to the right place. The patellar tendon attaches that muscle, that would be the muscle here of the upper thigh, to your shin bone, right below the kneecap. And that is the patellar tendon. If you recall, if you recall when I did the knee jerk test on somebody in here, I don't remember who it was, yeah, it was Patrick. I had you sit up on the table and I banged on that right here below your knee, and I caused your leg to kick out, okay? Patellar tendon is what that's called. Gastrocnemius, muscle or bone?
Bone.
Muscle, located where?
It's like back of your calf.
Back of your calf. That would be this muscle right here. So imagine the frog's legs are kind of bent out to the side. So this is the front of the thigh, that's the back. This is the front of the calf, that's the back. So this muscle here is the gastrocnemius. Not listed on the board, but one I am holding you responsible for is the tendon. The tendon that goes from this muscle to the ankle. The big ropey thing on the back of your ankle is the Achilles tendon. We learned that in human anatomy. The femur is located where? Upper leg. That's the main thigh bone. And metatarsals are located where?
Your toes.
No, they are not your toes.
Ankle.
They are between the toes and the ankle. They are the bulk of your feet. Those are the bones in your feet that aren't your toes. Okay? They are right in here where my thumb is. Now when you recite these names back to me, make sure you can pronounce them correctly. Rectus femoris, patellar tendon, gastrocnemius, Achilles tendon, femur, and metatarsals. Understand this, that some of the things, some of the structures are named the same for the frog. Some are not. I could have you remember the frog name, but to be honest with you, I don't think that's all that useful. So I'm going to have you call it by the human name. For instance, these bones that go from toes to ankle, right in here, are not called the metatarsals, technically, on the frog. They're the astragalus bone. The astragalus bone. You don't have to know it by that name. I want you to, have some practice with our human name. So that would be metatarsals. Okay? First thing you want to do when you're trying to get to the muscles and the bones is work by layers. The outermost layer, of course, is the skin. So we'll take the skin off first, and then we'll get the muscles that we're looking for. The rectus femoris and the gastrocnemius. After that, then we'll remove any other muscles that are in our way so that we can get the bones. Okay, so it goes skin, then muscle, then bones. And we're going to try to separate the bones so we don't damage them, so we can see what the bone ends look like. So the first step then is to remove the skin. You start by cutting right down the thigh, underneath the skin. Remember, the skin separates pretty easily from the muscle. And down the calf. You'll find that the muscle and skin kind of stick together near the joints. It's a lot tighter right in here, but you'll cut right down along the leg, all the way down to the foot. Okay? I'm going to go out here a little ways out towards the foot. Now, that's still not enough to get it off all the way. What you need to do is start to peel it away. And you'll see that it's going to hold together here on the back as well. So I can lift this up and cut down the middle on the back. The nice thing about this check is if we screw up, we have an extra leg. We're only going to do this on one leg. So the other one you can leave untouched unless you screw up. Then you can go do the same thing on the other side and hopefully do it right. Okay, so this will just peel right off. And if you've been hunting before, you know a little bit about skinning an animal. Sometimes it comes off pretty easily once you get a chunk of it like that. It does hang on around the joints. You just kind of pull that away. You can separate it fairly easily. So I'm just pulling this away near the knee joint, and it peels right off in one piece. Okay? The cool part is when you get down here to the feet, you would think skinning the feet would be pretty hard. Nope, it's just like pulling off a sock. Just in one piece. Well, I didn't do a good job there. Pull it apart. Comes right off just like a sock. Okay? So I got my skin off now. Put that in the bag. We're not throwing anything out just in case we need it later for our final check. And I've got one leg skinned and one not skinned. Okay? I only need to work with one. So, if you wanted to, you could cut right down the middle here. It's really not necessary. I prefer that you avoid doing that because if you cut in the wrong place, you'll end up damaging the bone. And we want this leg bone right in here, the femur. When you look more closely at this muscle, it appears as if it's all one solid piece. In fact, the muscles of your thigh are more than just 4. We call them our quadriceps, but there's more there than that. And if you look at them, they look like they're just one big muscle. But if you look more closely, first of all, you see this line. That one's pretty obvious. But there are other lines. If you start to really examine it here, you can see a line here. You see that? Starting to form. This line shows me where the rectus femoris, the one on the front, is separate from the ones here on the side. And of course the ones on the side are separate from the ones on the back. They work at different times. All of these muscles are held together by clear tissue fascia. It's pretty sturdy stuff, and it forms what they call a compartment. Okay, so it looks like it's one right now. I can tell that that line starts here and it probably goes somewhere like this, but I'm not sure. So I'm going to go ahead and take some of the muscle behind it just to be sure, because I can separate it out later. I'm going to open up my scissors and I'm going to take the end and stick it through here right at about that point, all the way through to the other side. Okay? I want to make sure that I do not cut the leg bone. Okay? The leg bone looks like this. The femur, this is the femur here. Okay? This one here. And it's got a ball end here which really doesn't show up very well in that picture. And I don't want to cut through that by accident. So what I'm going to do when I get my scissors through like I just did, I'm going to feel around and I'm going to go this way and I'm going to go down. And I want to make sure that I feel the bone is on this side, right where that probe is. I don't want it to be on this side because when I turn the scissors around, like so, I would cut through the bone. Get it? I want it to be behind my scissors over here. I think I'm in the right spot, so I'm carefully going to start cutting the muscle here near the top. If you feel resistance, significant resistance, you are on the wrong side and the bone is there. If the bone is there, you're going to need to take it out and plunge it in a little farther back. But I was okay, I didn't get the bone. So now as I go to pull this away, I can see, especially on the back, where the different muscle fibers begin and end. And I can even use my probe to kind of separate, and my scissors to cut anything that's holding it together. And I can pull this muscle away. And once you get it away, then you can see the separation more. Do you see that now? Yes?
Yes.
Okay. So I'm going to separate. I'm going to break through the fascia right here because I know that's where it keeps those two together. I'm going to separate the muscles. So I have just the rectus femoris. And I'm going to pull it away from the knee. Here's the knee right here. I'm going to pull it away. I'm using my thumb and finger, pinching tight so I can keep that all attached. You can see how the tendon that connects muscle to bone, this is your shin bone here, how it's a much tougher material and a different appearance than the other tissue. So I'm going to pull it over the kneecap about that far to where it starts to attach to the bone, and then I'm going to snip it free. That, of course, is your patellar tendon. So I've already got my rectus femoris and patellar tendon there. Then I want to get the muscle on the back of the calf. So we just took this one on the front of the thigh. Now it's back of the calf, this one here. That one's easier to see where it begins and ends because it's the only bundle there on the back. So I just put my scissors in here, making sure I'm not cutting bone. Just cut the muscle, peel it away. Got a lot of dye there in that spot. And this is the tendon that connects your gastrocnemius, your calf muscle, to your foot, to your ankle. And it wraps around your ankle just like it goes down past your ankle. I'm going to hold it right here and I'm going to pull it right off. And it'll go all the way down the bottom of the foot. We don't need to go that far. We can cut it off right about there. So that muscle looks like this. Much more slender and a longer, skinnier tendon, the Achilles tendon, than what we see on the rectus femoris. Broader, with a broader tendon. It goes over the knee. Okay? So I got my two muscles. Now I'm on to bones. The first bone you're going to go for is the femur. It's best to get other tissue out of the way. We're not worrying about saving this stuff, so you can pretty much cut that away however you like. You can see the bone there already, so I'm just going to cut right below the bone there and get some of this muscle and peel it away from the bone. Being careful not to break the bone. You can do that quite easily at this point. I'm going to cut it away from the bone so I can see that joint better. I'm going to do the same thing up here on this end. And you can start to see in there, right in here, the ball for the ball and socket joint. This end of the femur fits right in the hip bone. The hip bone's up here to make a ball and socket joint. So I'm going to wiggle around so I know exactly where I'm dealing, what I'm dealing with there. I'm going to cut away any other muscle that's in my way so I can see in there. And then I'm going to separate the bones. What connects bone to bone? Ligament. And right on the very end of your femur, there are some big tough ligaments that hold that ball into the socket. Right at the end of that ball, there are ligaments that hold it in there. So I'm looking for that point where the end of the ball, right here, goes into the joint, right about where I've got the probe right now. And so I'm going to have to cut any of this other muscle out of the way so I can really see that specific spot. Then I'm going to use my scalpel to get in between the two and cut through any ligament that's holding that on. Once you do that, I'm just going around the ball of that joint. That should be fairly free, and now it is just a few little more pieces of muscle. You can see some of the ligament right there, kind of whitish, holding it on still. And there's the socket right behind it. So I can just cut this off. And I now have the head of the femur. You would want to take some time to clean this off and get all the soft tissue off. I'm not going to take as much time as you guys would, so that you just see that nice shiny ball on the end of the femur. Okay? In here, there's the socket. And it's pretty shiny inside too. It's really well lubricated so that thing can swing around in there quite easily. Okay? So that's the pelvis. But now we're just dealing with this part. So I've got my femur and I've got my knee joint here. Same thing. I'm going to kind of wiggle it back and forth so I can see the part that's wiggling is the bone I want to save. The part that isn't wiggling is the other bone that I don't care so much about. In between is where I need to make my cuts. That's where I'm cutting the ligaments, whatever's holding those two together. There's the end of the shin bone right there, just like ours. And that's where there are ligaments that hold the two together. So I wiggle, see what holds them together, and cut it free, either with the scissors or the scalpel. Same deal, once you get that free, clean up all this stuff, get all that off the end so you just have a nice femur to show me. The last thing to get are the metatarsals. The metatarsals are the bones between the toes and the ankle. And it's actually some fused bones. And I showed you a second ago what it looked like. Let me show you here again. Metatarsals, they call it the astragalus, but we're going to call them the metatarsals. You see these two bones here? They form a little box with bones at the end that are fused together. So you're going to get something that looks like that box. See it up here on the board. So you're going to have to take the meat, the muscle, out of the middle of the box and around the outside and separate it from all the phalanges and from the shin bone. Okay? Now that you know what it looks like, you should be able to separate that out. If you screw up, you can work on the other one. Are there any questions about this check? No? All right.